Hello, everyone. I want to start with a confession. And no, not the kind that requires a lawyer, a professional confession. For years, I honestly believed that medical errors were just part of the job. A tragic part of the job, but inevitable. Especially when you're young, you're overwhelmed, and you're trying to remember which end of the stethoscope goes where. It felt like medical errors were built into the system. Now let me paint the scene for you. It's 3 a.m. in the ICU. The alarms are blinking an aggressive shade of red that feels personal, and the fluorescent lights are humming in a way that makes your headaches louder. Everyone is so tired, and they're reconsidering their career choices. But then, a patient stops breathing. The room shifts instantly, and everyone moves. Teams rushes in. The doctor calls for the airway equipment. The respiratory therapist sets up the ventilator, and the nurse positions the patient. Everything looks under control. But suddenly, and within seconds, the patient's heart rate crashes, and a nurse freezes over the medication tray and sees it. 2 syringes, same color, same position, but given in a very specific order. The paralytic drug, the one that stops you from moving and breathing, was given before the induction drug, the one that puts you to sleep. And that is a true error. That is the wrong order. Suddenly, the room erupts into chaos, and the hands move with terrifying precision, and seconds feel like minutes. But then, the airway goes in. The chest rises, and the oxygen climbs, and the room exhales as one. You hear a junior doctor whisper, barely audible, "Phew. That was a close one." Patient survived. But then, a form called an incident form is filled. A few heads shake, a few eyebrows are raised, some conversations, but no deep learning, because that is how the system worked. Now everyone pause with me, and imagine that same medical error happening to someone you love. That was the thought that shook me awake and made me wonder, what if medical errors were not just tragedies that we have to endure? What if they were teachers? Very painful, very frightening teachers, but teachers. And what if there was a way to learn from them before they ever harmed a patient? That's what simulation does. But first, let me share a number that hurts me every time I say it. According to recent data from the WHO, 3 million people die every year due to unsafe care. And the leading cause of death? Patient harm from unsafe care and medical errors. That's 3 million. That's the size of a jumbo jet fully loaded with passengers, crashing every hour, on the hour, and we still somehow call that normal. And we still somehow sometimes let nurses and doctors train for the most critical moments of their lives on real patients for the first time. Now imagine if pilots trained that way. Good evening, ladies and gentlemen. This is your captain speaking. This is my first time turning on a plane. I think it's this button. No one would fly, ever. But the reason it's safe to fly is because pilots train hundreds of hours on simulators before the real thing. And in healthcare, that's the case. This is healthcare simulation training. It is a way to practice real clinical moments in a safe and controlled environment during a structured scenario, using mannequins and trainers and never real patients. And there's no doubt that it is a powerful learning methodology. But here's the thing. The real magic of simulation happens after the scenario is over, when the team sits down and discusses what happened and why through reflection and feedback. This is what we call the debriefing. And what makes these conversations truly magical is a tool called advocacy inquiry. Now, advocacy inquiry comes from the work of Chris Argyris and David Shawn on how people learn. And it was brought to healthcare training by Dr. Jenny Rudolph. And it's a way of having honest conversations to uncover the reasons behind actions and behaviors without blame. Advocacy means that I say what I saw and what I think. And inquiry simply means that I invite your perspective. Together they become, I saw, I think, I wonder. So when a junior doctor gives the wrong drug during a simulation resuscitation training, the old school response is, you messed up. Don't do that. Do this instead. But imagine instead saying, I saw you reach for that drug. I think that medication is the cause of your patient deteriorating. I wonder what guided your decision. Suddenly, the wall between us vanishes. There's no shame, there's no blame, there's just curiosity. And when we do that, we have a better chance to uncover the drivers and what's underneath the action, and we have a better chance of that not happening again. And that shift from judgment to curiosity is the heart of learning through simulation, and without it, simulation doesn't work. It is also the heart of safe teams, and actually it's the heart of being a decent human being. Now, for advocacy inquiry to truly work, you need people to feel safe enough to speak and feel safe enough to be wrong. And that's psychological safety. So everyone in this room, think of every team you've ever been a part of. Some teams give you respect, but zero permission to speak. You're included in all the meetings, but like a houseplant is included. You're present, you're silent, you're decorative. Other teams let you speak, but respect is non-existent. You talk and talk and talk, but no one's listening to you. Psychological safety is the cultivation of both respect and permission, and Tim Clark maps that beautifully. Inclusion safety means you can be on my team, but quiet. Learner safety means that you can ask me questions, and I'll be happy to answer them. Contributor safety means that you can propose. But challenger safety means that you can disagree, even with the boss, and not get fired. And the last one is where the real magic happens. So when a nurse sees the doctor prescribe a medication to a patient, she looks at that paper and hesitates, then says, "Doctor, I think that dose is too high." She was right. That tiny moment, her courage to speak and everyone's openness to listen to her prevented a potential error. And that is psychological safety made visible. And that is advocacy inquiry turned into culture. Now let's zoom out and watch this together.
ETT 7.5. Section. Give me code one. Which one? Code. Ambuwag.
So we lost a patient. That was a failed intubation. And earlier in my career, when something wrong like this happened, I mapped it and analyzed it like this. A straight line, a blame line. My thought was, who messed up? But when I zoomed out and mapped it properly, that picture exploded from one mistake into a web. Many, many issues, equipment, tools, communication, roles, clarity, hierarchy, fatigue, many tiny nudges, pushing the same team towards the same error. And believe me, errors are not loud, they whisper. And moving away from who failed to what conditions made the right decision harder to choose is the essence of what we call systems thinking. And systems thinking is a framework that was brought by Dr. Ludwig von Bertalanffy. He was a biologist, and he saw that just like cells in the human body respond to their environment, Healthcare systems, and honestly any systems and any teams, their behaviors are shaped by the conditions that surround them. And when you combine systems thinking and advocacy inquiry, those errors, those whispers become louder and very hard to ignore. And now many years of academia and working in medical education and hospitals and simulation taught me that simulation is the perfect laboratory for redesigning the system and testing the system before anyone is at harm, any real patients get at harm. Because in simulation, the 3 big wins of change happen. The first win is productive failure, where failures don't define you, but refine you. The second is mastery learning, where true competence is achieved by repetition, reflection, and feedback, and not just, I'm going to try it again and I hope I get it right this time. And finally, reliability, because we fix systems and we don't just fix people. And we don't train just to get better doctors and better nurses, but safer systems. And that is how aviation became one of the safest industries on Earth. So anyone flying today can rest assured your pilot is very well trained. Now I want to go back to my confession. I used to think that medical errors are inevitable. Now I think they're preventable if we train with intention, lead with curiosity and advocacy inquiry. And my simple challenge to all of you is this. In a moment of pressure, the next time you find yourself see someone do something and you think, what in the world was that? That is so wrong. Pause. Don't react. Don't judge. Try instead. I saw. I think. I wonder. That single move creates safety, ignites curiosity, and opens the door to seeing the bigger picture. And you don't just change one conversation. You change a culture. And maybe, just maybe, you can help prevent that medical error from ever touching someone you love, because we learned before we harmed. Thank you very much.